For complete study material, contact through WhatsApp on the displayed number. A woman patient is abdominal pain. She complained generalized plan nausea, vomiting and constipation, rebound tenderness and abdominal rigidity the past hour. Her localized on right side. BP 130/68 HR 92, rural route 18 Tem 38.6. What should the nurse suspect? A. Intestinal obstruction. B. Influenza. C. Appendicitis. D. Pyloric stenosis. A man is to be discharged from the general appendectomy. The precautionary measures, plans are discussed with him. What is the most important desired outcome after discharge? A. Remain free of post-surgical complications. B. Report fever, redness, or drainage from the wound site. C. Use pain management techniques appropriate. D. Resume gradual activities and avoid weight. A 10-year-old girl presents to the emergency room, ER, with pain. On assessment, you notice that when you palpate the right lower quadrant of the child's abdomen, the child feels pain in the rig quadrant. Which of the following is the name of this sign? A. Rebound tenderness. B. McBurney sign. C. Roving sign. D. Obdurate sign. A 10-year-old girl presents to the emergency room, ER, with pain. On assessment, you notice that when you palpate the left lower quadrant of the child's abdomen, the child feels pain in the rig quadrant. Which of the following is the name of this sign? A. Rebound tenderness. B. McBurney sign. C. Roving sign. D. Obdurate sign. A 66-year-old woman with a history of unstable angina and hypertension present to the emergency department with a dull chest pain that she describes as similar to heartburn. The pain radiates down the left arm. She had taken sublingual nitroglycerin tablets with any relief. Any electrocardiograph is performed and shows elevated ST segments. Which medication is most likely to given to dissolve the thrombus? A. Heparin. B. Warfarin. C. Streptokinase. D. Aspirin. 62-year man with a history of intracerebral bleeding 3 months ago, was referred primary health care following acute starch symptoms. Brain CT scan is normal and the patient is receiving oxygen by nasal cannula at 4 lpm BP 185/105 HR82, rural route 18 Tem 36.602 93%. Which of the following medication would be ordered first? A. RTPA. B. Aspirin. C. Dopamine. D. Nicardipine. A nurse checks the medication chart of a patient, which has the following order: nitroglycerin tab sublingual. Which of the following medication administration routes should the nurse use? A. In the nose. B. In the eyelid. C. Under the skin. D. Under the tongue. A 28-year man admitted to orthopedic ward complaining of throbbing pain in cast leg. Which of the following nursing intervention should be taken first? A. Remove the cast. B. Notify a doctor. C. Assess pedal pulse. D. Administer PRN medication. A 62-year-old woman presents to the clinic with a primary complaint of fatigue. An assess shows a smooth and reddened tongue with a loss of papillae and pallid mucous membranes. She complains of a sense of constant fullness of the stomach, with a decreased appetite and 2-3 loose bowel movement per day. A neurological assessment shows numbness in the feet and lower legs. The patient type of test would the most likely? A. Schilling. B. Erythropoietin. C. Folic acid levels. D. Vitamin B12 levels. A mother of a patient who is on antipsychotic drug asked a doctor about some more detail about the drug. The doctor told the mother that her son is taking an atypical antipsychotic drug. Which of the following is an examples of this type of drug? A. Thioridazine. B. Clozapine. C. Chlorpromazine. D. Haloperidol. Thank you for watching. For complete study material, contact through WhatsApp on the displayed number.